be sharing my experience as a family doc and an aesthetic doc, what I see in my practice and what I do with my clients. So, such an interesting topic. The reason why I say it's interesting is most of us have gone through. I'll tell you my situation. I had really big stuff, okay, like really big comedonal acne, I would say, when I was in my, I would say it started about 10 to 11. And it's so fun. Like whoever knows when you're popping it, it's so much of fun. And I really still up to date. I really enjoy popping the pimples. So if you ever have a pimple to pop, feel like come this way, we'll work it out together. It's so much of fun, like ding, and it feels so great, isn't it? I think you agree. But the honest situation is, a lot of people would say, don't pop it, right? So I agree with it, and I also disagree with it. The reason behind it is if you don't pop it, and in some of the philosophies in medicine is if there's any pus, like some of those ones which will have infected sebum, which is like, infected material, if you're going to leave it out there, what's going to happen is it's going to form some scarring, right? Scarring of the whole gland, because as you know, the top is the skin and the gland goes underneath. So here you have a blockage, what we call a blockage of the pore, as a result of pollutants, whether it's going to be makeup, whether it's going to be some of the hyperkeratinization of other overgrowth of your upper layer of the dermis, anything, whether it's a scar from a previous injury, from a bicycle fall, you name it, right? Or whether it's going to be such a condition where you're working in a very greasy environment and you're being exposed to very greasy, humid conditions where it's naturally, when you're thinking about the diffusion, right? Your body want to sweat and have the oil extruded, but the atmosphere is even more. It's not going to unfortunately diffuse, or it's too cold, right? Most of my clients who are coming from East Asian countries, predominantly, I would say, it's really fun. When they come in, they say, Doc, I didn't have this. For example, back in Philippines, I've got a lot of Filipino clientele here. They say, I didn't have this in there. I had great skin. And here I come, and then I get all this acne. My asthma got better because I'm practicing in Toronto, Canada. The air quality is great, but no, I got acne. I had never had acne in my life. So I was going through all these things, and well, obviously the food chain changes, right? We are going through different high fatty acids in the food chain, obviously. But if you're going to look into, most of the time when I look at the pattern, and being a family doc, that's the beauty that I have. I follow through my clients over a period of time, right? When I was in Ottawa and even before coming to Canada, I used to deliver babies. The thing that I love most, it's so fun, so much of fun. A lot of adrenaline, mommy crying, baby crying, father crying, everyone crying. First when they cannot get it done, and then afterwards after getting it done. It was so much of fun, trust me. So, can babies have acne? And some of you know, yes, babies have acne, right? So that's because of the maternal hormones are stimulating the baby's skin, and they are born with acne. I delivered many kids who had acne. That's fun, a lot of fun. Do they develop scarring? No, as a result of their skin tone always pretty high, so they actually escape it. It's beautiful, beautiful ones. So here you go. You have the weather, right? So I've been studying them from when I meet them, and with my kids, I go through them over their time. So newborn, and then childhood, adolescence, and puberty, post-pubertal, and until whatever it means, until I'm alive and until they end my practice, right? So that privilege is there as a family doctor. So now that I'm as an aesthetic doctor, so I combine both of them, right? So here I look at the people's inner aspect of it, their belief system, what is their blood pressure, their cholesterol, their kidney function, their liver function, how is their gynecological perspective. I do have a big female clientele where we are going through either it's going to be contraception, whether it's going to be delivery, conception, want to get pregnant, postpartum care, or it's anything like management of the skin. And then there's the polycystic ovarian syndrome, as you know, right? It can also affect on someone's acne. So with this food chain, and when I was looking at this, I said, and also the same client, and I see that there is also seasonal pattern, right? So as in Canada, we have in Toronto, I practice in Toronto, we have 4 seasons. It's great. And in the winter time, I find that before the winter starts, they start to be developing acne. And then if you don't do anything, some of the clients would prefer not to do anything. And then after some time, it starts to be fading away. And I said, especially when the summer times come in. Aha! So the weather, when it got warmer, it did not allow the fat or the seeds to be get frozen. It's just like frozen yogurt inside your skin, right? Because here we can go, depending on where you're in Canada, from plus whatever it is. Majority of the time in winter, here and there some minus, up to being predominantly minus 10, 15, 20. So when you have that kind of an atmosphere, your sweating becomes very diminished, and also your excretion of the oil become diminished, because oil, as you know, oil will start to be getting condensed or free. So when under the skin, when obviously for the winter we'll be applying a lot of things on the skin to protect the skin, and here you go, the top has been blocked now, and then the gland is getting accumulated with the sebum, and here you are producing, depending on your ethnicity predominant that I had seen, now you're starting to be producing something that you didn't have before. And because of the East Asian skin, most of these clients will start to be producing also pretty dramatic scars. Unfortunately, they tend to be performing hypertrophic or keloid scars. So now this becomes a huge thing. And obviously, if you know about Korean skin and the rest of it, they're really great at managing their skincare. So being in the proximity, most of these clients will really have good skincare routines. But then again, even though the skin is get better, or getting better, there is I see a huge discordance between their belief system, or how their image or personality have been affected, together with what's been in the skin. And that actually leads to such emotional, it has an emotional toll. Some people get very depressed. Some people get very self-conscious. Some people go into paranoia. Will it come back again? Will I go through the same thing? Will I be accepted? Will it come before my marriage, before my date? Will it happen again if I stop the periods, right? So who had gone through this, you exactly know what I'm talking about. This is creating a vicious cycle, a loop of expectation. Will it come? And then God forbid it comes, and then it becomes such a difficult journey for us to go through, emotionally as well as physically. And as you know, this is a journey, right? So acne doesn't always come boom early morning, and then you woke up with like 50 comedones, or inflammatory comedones, or nodular cystic acne. It is a process. It goes on slowly, and then afterwards you start to see, well, it's nothing, or itching, or you're gonna pop it or not pop it, and then there's the bumpiness, not the best. Here you go, now you start to be paying attention. You go over the counter, get everything what's on there, start to be working on. So during this time, while we are trying things, our expectations are here. I want my skin the way I used to have, right? Our image, the inner self, will be fixated there, and the external self is here. So now we have this discrepancy, and then we're going through the treatments. So we want this discrepancy to come boom within the shortest period of time to what it used to be. That's the normal human nature. And the funny thing is, we have a negative perception or negative bias, right? Our human brain quickly get attached to the negative stuff, and then it creates a loop of, oh my god this, oh my god that, oh my god this, and ding 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 ding, self-worth goes down, confidence goes down. When a person is going through less self-esteem, less confidence, obviously, the productivity goes down, their self-worth goes down, and it affects everything around them, whether it's work, schooling, relationships. And I see this all the time. So that's when I said, you know what, I need to definitely work with these clients. As a physician, I understand them. We go through this situation to see internally, is there anything that can reflect on the bloodstream? Is there anything which suggests of a gynecological endocrinology together, endocrine endocrinology, whereas like a polycystic ovarian syndrome? Is there testosterone producing situations? Is there anything which creates a much more familial dyslipidemias or hypertriglyceridemias, right? So there are a lot of fun stuff that we go through. So is there anything like that? Is there a genetic component where genes are coming for either they become very cystic, or they become very scar producing skins? And with all those things, how much of this person's belief system has been affected? If we do not address both pathways, you'll always find there's something missing. Okay, if you deep dive into it, you'll start to see there's something missing. Not every client is gonna come and say, "Wow, I get this great skin," but internally I'm like zero. No one is gonna tell that. Okay, so that's, I think, is the art of this treatment. You want to get to know whether did you heal externally and internally the person. So when there's that match, and the greatest thing what we can do as healthcare providers is to empower all these clients. We educate them where the situation is, how it may recur, and also set expectations, right? So when we say, okay, I'll cure it for good, and then afterwards it's coming back, we give false expectations. The client loses trust. The client will, again be affected. And every time, as you know, re-traumatization stays longer in the system, right? When I treat depression and anxiety, I know even this, the guidelines in psychiatry, we know that every time when a person is bouncing back, the recovery time is longer, and the presentation is sometimes much more deeper and longer. Same thing happens in this situation. So set expectations that it is a journey, that we need to know we have to take it as it comes daily, and we are appreciative of what we see today, and the comparison of what was and what need to be is what actually make the people to be much more distressed. I want to be there, this is how I used to be, but here I am, and that actually conflicts. So having a very honest discussion will help them to understand, because as a healthcare providers we see people going through the journey, right? We see them when they're great, when they're having the situation, and when they had recovered. Going through this in our practices many times, we know that how a client would perceive. But for a client, it's their journey, right? They never had acne, now got acne. Oh my God, everything, when they had the plans, this came in, and it's a total chaos, right? It just derails them. If we are understanding that psychological component and treating the inner person together with the external appearance, I find it's going to be great. So how do we treat acne? Many ways, if it's going to be inflammatory acne or non-inflammatory acne, depending on that. So that's what we call the whiteheads and blackheads, and then you have the inflammatory ones, the red, painful, itchy ones. Then you have the nodular cystic ones, and also there is the much more acne conglobulata. There is this immunocomponent where our immune system is also responsible. Some of those clients will also go through something like hidradenitis suppurativa. I've got quite a bit of clientele who've got very, very resistant treatment hidradenitis suppurativa. That's when we are using combination of antibiotics, keratolytics, as well as what we call the immunosuppressive treatments or the biologics, right? Because its immune system is also aggressively attacking it. Every time it attacks, it produces a scar, because every inflammation and infection causes the healing process. Healing process brings white blood cells, macrophages, fibroblasts, and then to heal it, it heals it, it forms a scar, but the body doesn't know where is the exit point and where is the actual sac. It'll start to be sealing it off, like, put concrete there, right? So once the gland get connective tissue or fibrous or scarred, now next time, God forbid, when it starts to be coming in, it's a thick wall. So if it is infected, if there's Cutibacterium acnes there, we cannot get antibiotics to go inside because it has a thick wall. And also, when that scarring happens, it also clogs the top layer, right? So the excretion of the sebum or the fat doesn't happen. So now it's going to lead to another episode. And if we do not prevent from the first off and educate the client how they can heal, keep themselves to be having the exfoliation, whether it's going to be lasers as energy-based devices to have the exfoliation happening, and keep the pores open, educate about the process, and then what to expect it, and frequent follow-ups to make sure that they are being emotionally well as well as physically well. I find this is a journey that I truly admire with my clients. And the benefit is I see them for different reasons, right? I see them for a sore throat, I see them for a cough and cold, I see them for gynecological concerns, I see them for something else, for occupational concerns. And every time when we meet, I always would address and guide them on, well, something about hair, whether it's going to be about skin, whether it's something else. Because for a client to appreciate that there is something going on, it may take some time. But if we see early signs, let's encourage our clients to make sure that they take action early. Because as you know, this is a journey, this is a process, right? So once there is the infection, if there's infection setting in with the Cutibacterium acne, we'll get the antibiotics to kill it while we're declogging and cleaning the pores and rejuvenating the skin. So there are different techniques that we use depending on the person. So there can be topical ones like retin A, Stevia. That's, these are all trade names, but basically what these means are these are keratolytic agents, which means the keratin layer, we take it off, and these will start to be expediting the skin turnover. With it, the skin will rejuvenate. You'll start to see a nice, glowy, hydrated skin. But obviously, you need to moisturize it and sun protection. If the sun is not protected, because this new growing skin is, it doesn't have defense much, right? It doesn't have that dead keratin layer because you're removing it. So the ultraviolet rays come and then it'll burn the skin. And then you get the inflammation. And when the inflammation comes in, it'll again clog the pores, right? It can be from seborrheic dermatitis. It can be from the seborrheic dermatitis scalp or the face. They will also block it. It can be from psoriasis. It can be from another tinea infections. Many conditions can block the pore. But again, we would definitely want our clients to be protecting their skin from external damage, because that will be one of the causes where the surface inflammation happens, blockage of the pores. And if the bacteria, we talk about antibiotics, tetracycline, doxycycline, erythromycin group. Clindamycin, we don't use it much because of that's the resistance nowadays. Again, there are antibiotic-containing keratolytic agents like clindoxyl gel. There's a stevia cream. So there are many fun stuff out there. There's the benzoyl peroxide together with adapalene. There are great stuff. So depending on what your acne persists, what grade of acne, there is 4 to 5 grades, and then we will determine which one is the best treatment for you. And if it had produced in scarring, that can be box scars, ice pick scars, or roll scars, mixed scars, what we would suggest our clients to go through is, depending on the severity, depending on their perception. Some are needle phobic, some are pretty great. Some would like chemical peel, or they may be a suitable client for chemical peel. How you can facilitate economically, your availability, punctuality, reactions, everything. So we take into account that factors, and then we'll look into see how we can help your scar. The scar is, it may look on the surface not much, but most of them are being attached deep into the bottom layers of the skin, to the dermis. So we will have to cut it off. So we use different techniques, and we get the scar release, and then we remodel the skin, which means we are growing the skin, we're stimulating new growth of the skin, but with it we are having the scar to be what we call the adhesiolysis, for example. Right? Adhesion is like a connective tissue band, so we are dissolving the scar. It can be with a strong chemical peel, what is a medical grade one. It can be with microneedling. We are causing what we call collagen induction, but a controlled collagen induction, where we are stimulating the layers of the deeper skin to grow, and we are remodeling the skin. We cause a controlled inflammatory reaction of the skin, and with it the skin is supposed to grow and get rid of the scar, while we are dissolving scars with the other agents, right? So that's one of those ways. And we can use the energy-based devices, lasers, especially with CO2 lasers, phenomenal results. So all this arsenal, we can use it depending on the severity, the client's belief system, perception. We have to take into account of everything. And I always tell my clients, it happened over time. Also expect a similar time for you all to have a good response. When I say a good response, it's not only external, but also internal. Because when human mind attached to scars, it has two personalities, right? It has the scarred personality. It also has the perfect personality. How it should be, how it used to be, right? So we have this in the human mind, this there's a bipolar way of going back and forth, and this current situation is really hampering. And then I always tell my clients, always consider and then think positively, because if you're going to get adhered to this, our human brain will quickly attract it and bring it back. Again, these are a little bit spiritual stuff, but there's a lot of truth into it. So on your acne journey, look into a blood test. Why? There are different reasons what can actually accelerate. There could be liver situations. There could be metabolism dysfunction of your lipid profile, triglycerides, whether there's a familial hypercholesterolemia and the rest of it, whether there's polycystic ovarian syndrome, whether there's associated with sugar imbalance and diabetes, how is your testosterone level, whether there's a possibility of polycystic ovarian syndrome. Look into it, because from that we can get a lot. That also we are healing the client internally. We are not only externally patching it up. That goes really well. It's not only giving you a kind of a polished tip of the iceberg, but underneath is all rusted. There's no point in it. We want to guide our client with what they come and also their future, how they can take care of it, right? So that's what we do in our practice. And I wish you the same. So thinking about cancer prevention, thinking about the immunizations, everything matters when a client comes in, because healthy young people rarely would want to come and say, do every prevention for me, right? Life is busy enough, schooling, studying, and the rest of it. So when there's a concern, let's work out the client in and out and help them out in every aspect. Number one. Number two is that also we are doing a great service for a human, right? Not only what they come for, we are offering more than what they came for, because everything is connected. Number three, also have frequent follow-ups with them. Some of my clients, we give treatments, and I would tell them I would like to see back on this, because two type of clients, right? Either they will apply, don't see a result because their belief system is here. I got a treatment, I need to be here by this day. They won't tell that, but that's how the human philosophy works. They don't see the result, they lose hope. Some would push through, some would not. And then they say, what, it doesn't work, they go to a next therapy, right? So unfortunately, we haven't given the proper timing for the therapy to work. So having a follow-up, we also will listen to them, see how they're going through their emotional journey as well as the physical journey, right? So having those follow-ups actually matters a lot. There are ways we can elevate them, go through the journey. It's extremely important. Technicalities of treating acne is everywhere. Anyone can learn it, anyone can have access to it. It's not a big deal. But what I encourage my clientele to go through, or is to tell the inner aspect of their belief system. No one want to open up and tell their negative side of it, right? No one want to say how much they are being emotionally being hampered by this. If we do not address that, and I would think that's half of the journey. And regardless, it can be phenomenal. The human brain will still come with some flaws, right? Most of us would know. There are some clients who would come for a very minuscule thing, which is not even visible from a distance, or sometimes in 1 foot of proximity. But that means the client's internal belief system is not being correlated with what they are externally seeing, right? So I hope this will create some awareness. It's an interesting journey, and I tell it's a journey. I always tell my clients, it's a journey, and let's set expectations. And when you start in that tone, there's a lot of trust build up. There's a lot of confidence coming in. Because confidence, we don't lose it right away. We also lose it gradually. It's hard to pinpoint. So this journey, let's empower clients. Let's get all of you all to be getting back where you want to be. Let's go through this journey. It's a mutual journey, and thank you for the trust that you're giving us. And I wish you all the very best and success. And if you think this video intrigued you in any way, if you think others would also benefit from it, give a thumbs up, give a like, and then share it. That would be great. It's a service for humanity. We all have a duty for each one of us, and let's discover how we can fit into your life and how you can fit into your life. I wish you success. Dr. from Dr. Aesthetics. Cheers.